Welcome to our brief presentation about using the Family Involvement in Dementia Care training series in a support group setting. This presentation is designed for support group leaders with the goal of offering tips on utilizing this series and additional training materials, as well as keys to leading an effective dementia support group. This training is best used as a series, as some of the content and ideas discussed build as you move through each presentation. That being said, each topic has been structured so that the presentation can be viewed independently if the learner has interest in only select topics. The information discussed in this series works hand in hand with a series developed for healthcare providers. The goal is to create a common language and discussion for both sides to foster teamwork and a partnership approach to caregiving. The series includes various topics about working with providers and being engaged in your loved one's care. Each presentation is roughly 10 to 15 minutes in length. Woven throughout the presentations are additional breakout pieces, including tips from family caregivers on particular situations, real-life scenarios, and discussion questions. If you are a support group leader, please stop the presentation at these discussion points and open the question up to your group members for their input on their feelings or experiences. After the group has had time to discuss, you can then continue the presentation. The series is web-based for easy access so that the training can be viewed in a group setting, such as a support group, or by individuals in the convenience of their own homes. The presentations have been developed ideally for use in a group setting. However, we know that life gets busy and members are not always able to attend each meeting, so by having the series web-based, it allows for flexibility. Additional information on each topic is also available, including short videos of family caregivers discussing thoughts, feelings, tips, and experiences of being a family caregiver to a loved one with dementia. There are also resources and handouts on topics such as bathing challenges, wandering, and sleep disturbances. As a support group leader, please consider incorporating the additional information into your group meeting as you see fit. Every support group differs in the extent to which emotional support is shared and informational support is provided. Some support groups are designed to be heavy on the emotional support side, while on the other end of the continuum, some support groups are really informational sessions, where a main purpose is to give or share information. For informational support groups, do you assign topics in advance? That way, people who are interested in a particular topic can make sure to attend that session. You may find that the amount of time and effort spent on emotional and informational support varies from meeting to meeting, and that is okay. You may ask, which type of support group is best? That all depends on the needs of your particular group members, your group's purpose, and what other resources are available. The Family Involvement in Dementia Care training series is intended to reach both sides of the spectrum by providing information and education, as well as providing opportunities for dialogue and discussion. As you prepare to use this series in your support group, keep in mind the makeup of your group. Think about what you are wanting to accomplish for the members and how this series may best fit your needs. Would the group prefer to watch the series at home on their own and then use the meeting time to strictly discuss topics? Or is it best to watch each presentation within the meeting and discuss as you go along? Will you provide a handout on a particular topic at each meeting, or highlight where they can be found on the website? Things to consider may include: who are the members? Is it the same group of people gathering for each meeting, or can new people be added to the group at any time? Are the members considered a mixed group or a same boat group? A mixed group is open to a mix of people: spouses, adult children, and any other friends or relatives. A same boat group is focused on a specific group, such as just for spouses or just for adult children. What is the role of the group leader? Some support groups have a paid professional. Others have volunteers. In some self-help support groups, there is no official facilitator. As the leader, are you there mostly to coordinate the logistics or to facilitate the meeting? Are you there to ensure that everyone gets a chance to participate, or to provide information, or to help connect members with additional resources? To what extent are you aiming to help people learn good group skills so that they can share responsibility for the group's success? When does the group meet and how often? Once a week or once a month? Does the group meet for a set number of times and then disband, or is the group ongoing? Why is the group meeting? While most support groups are a combination of both emotional support and informational support, some clearly are more emotionally focused, and others are more informationally focused. Some people will be drawn to the opportunity to exchange emotional support, while others may find too much emotional exchange to be draining or threatening. There may be cultural, gender, and age-associated considerations for the facilitator to be mindful of. How will you gauge the effectiveness of the training? It is a good idea to check in with the group as a whole and with individuals separately to ask for feedback. As you are likely aware, being a support group leader involves putting a lot of effort into making the support group a good experience for the participants. Always be sure to make time for yourself and be aware of your personal limits in terms of emotional and time commitments to avoid burnout and to continue your own personal growth. Offering to lead a support group is an important commitment. Thank you for making the time to help others to connect, share compassion, enhance their ability to cope, and develop courage for their caregiving journey. Thank you for taking the time to watch this presentation. We hope that you find it useful when determining how to best present the Family Involvement in Dementia Care training series to your support group members.